Hi, my name is Kelly Verrill. This is my final project titled Mental Health Awareness in Schools, and it is a democratic analysis of requiring mental health education and mental health days in schools by law. To analyze this issue, we must look at the statistics. Statistics show 1 in 5 children and adolescents reported experiencing a mental health problem in the school year, half by age 14 and 75% by age 24 in some form. Examples of these are stress, anxiety, depression, family problems, self-harm, bullying, having a learning disability, or struggling with alcohol or drug abuse. It is also reported that mentally healthy children are more successful in school and life, and that suicide is the second leading cause of death among 15 to 19-year-olds. And these are the individuals who have decided to disclose this information. So it is also documented that 60% do not receive the help they need because of stigma, which is the concept that there is a negative connotation to being open about mental health challenges, and so isn't being discussed as openly as physical health. And the other reason is there is a lack of access to or knowledge about support and resources to services. Last year, a survey of 400 schools revealed that less than half listed mental health resources on their websites, and just 20% of them have a mental health action plan. If we look at this map from Pew Trust, it shows us that the states with access that have the highest quality of mental health services also have the lowest number of youth with mental illness. Mental health awareness is happening legally in two ways in our schools in the U.S. The first is the law requiring mental health education embedded curriculum, New York being the first state to require mental health education. On September 30th, 2016, Bill A3887B passed unanimously in the Senate to become part of health education in K through 12. Currently, 20 states and the District of Columbia include mental health in their standards. Supporters of this law say it's about time, and that it can be a segue into reducing the stigma that goes along with mental illness. Those in opposition worry that districts are unprepared to manage this type of open dialogue, and the situations that will inevitably come with it, such as educators not being adequately trained in crisis or suicide interventions. The second way U.S. laws are taking action is states requiring schools to allow mental health days as an excused absence, the same as physical health. True democracy in action, as earlier this year, teens from Oregon lobbied successfully to get the law passed. Oregon Governor Kate Brown signed the bill in June of 2019. A quote from one of the teens who lobbied: "It's really hard to make up tests and homework because teachers or the administration might not take it as seriously as a physical illness." The supporters of this law believe it will make a difference in society through acceptance of mental illness, and that hopefully it will encourage individuals to get the help they need to recover. Those in opposition feel students will take advantage of the opportunity to take days off when they don't need to. How is mental health awareness relevant in our own classrooms? As we discussed, 60% of children and adolescents do not receive the treatment that they need, either because of the stigma, the fear of a negative connotation or making it worse, or the lack of resources available to those children and adolescents. Number one, students need to feel safe in the classroom. The stigma hinders students' open discussions and prevents disclosing and then receiving that needed help. Secondarily, LGBTQ students are more than twice as likely to suffer mental illness, and LGBTQ students are 5 times more likely to commit suicide. This makes an inclusive classroom with a climate that fosters open dialogue through tolerance and support as important as ever. This will be a theme that is integral in the success of mental health awareness. How does this reflect democracy? Within the framework of a democratic school, the following conditions are defined by Apple and Bean. In part, here are two of them. Number 1, concern for the welfare of others and the common good. And number 2, faith in the individual and collective capacity of people to create possibilities for resolving problems. Regarding the common good, it is also noted by Oakes that in a democratic society, public schools should solve social problems. This is relevant since mental health challenges of school-age children and adolescents are on the rise. Democracy requires a coming together with a common goal, but it is not self-serving. It is meant to involve collaboration of all students, educators, administrators, and community members, with the goal being improving life in the community. This needs to happen individually and collectively, and include all citizens to create possibilities for resolving problems. As noted, first, it will involve collaboration and communication inclusive to all citizens. The goal of a democratic society is to meet the needs of the community. Then, and this is the very important part, the needs are dynamic. So Stitzline describes this process as a constant need for revealing problems, seeking an inclusive input, and envisioning and implementing solutions. So with an understanding that those needs and issues are going to be met with resistance, inclusive communication is going to be the key. So if the goal is to meet the needs of a changing community, this will be successful if it is collective. And I stress that the more diverse, the better, in an environment of trust, tolerance, respect, and justice. According to Teaching Against Idiocy, successful democracy is individual and collective collaboration with a diverse group of people to include multiple perspectives and personal values. So this brings us to the teacher's role. The vision is increased mental health awareness. The 2 action steps will be to remove the stigma and increase resources and support. The way to remove the stigma will start with a classroom culture which fosters trust, tolerance, respect, and justice. Education for all. In the U.S., each child is ensured a right to free public education that is tailored to his or her needs as stated by the amendment of the Title IX of the Civil Rights Act, which became the Individuals with Disabilities Education Act. Then, by actively using language that includes mental wellness with intent to increase awareness and talking about it becoming societal norm, just like physical health. The following are ways to increase access to support and resources. Support within the school, being psychologists, counselors, and social workers, and then external resources provided for the community outside of the school. It will be important to provide specific support that is inclusive of LGBTQ. So finally, putting it all together, with the vision being increasing mental health awareness at schools, action step 1 will be to create an inclusive environment. Teachers act as role models in the classroom, exemplifying tolerance. Trust is very important in this step, so students feel safe to speak openly in the classroom. By encouraging diverse opinions, the students will learn that their opinions matter no matter what. Ultimately, this will lead to collaboration and discussion in the classroom that includes healthy dissent. Then action step 2 of the vision will focus on changing the public's perspective. Starting as many conversations about mental wellness as possible with each opportunity. Examples of these are at open district forums, through classroom blogs or parent education courses, at board meetings, or speaking at state conferences. Discuss goals and ask for action steps. Take the example of the teens in Oregon who lobbied for mental health days, true democracy in action. Once advocates of the vision come together, the nitty-gritty work happens. This is the essence of the vision. As it takes shape, a task force can assign pedagogy, policies, and procedures. Teachers should attend continuing education to learn how to teach mental wellness. Collaboration with other states or districts who have a mental health wellness plan in their curriculum will be extremely beneficial. Here is an example highlighted in a video coverage of the Lubel and Snow article of a 5th grade classroom in Merrick, New York. As you look at this, you can see the teacher, Andrea McCabe, leads her class in an open discussion about stress, and then the students break into groups where they discuss ways to cope with stress. In general, mental health education described in this article is, in elementary schools, the curriculum focuses on emotional and social health and how physical and mental health go together and help each other. Then in the adolescence years, in junior high and high school, the curricula shifts to focusing on discussing what mental health is, what mental illness is, and then how to advocate for yourself and others. This final step involves 3 ways to increase student access to support and resources. First, through hiring a dedicated school psychologist or social worker. In some rural areas, access to mental health is minimal, and sometimes schools are the only place where there is access. Second, displaying services for students in the classroom, such as suicide hotlines, infographics, or posters that include resources. This should also include specific LGBTQ support networks like the Trevor Project, and online resources or apps. Third, teachers should become educated in suicide risk signs and intervention. This concludes my democratic analysis on increasing mental health awareness at schools. I hope you found the research helpful. I really enjoyed creating this vision, and I hope it helps other teachers.